Good morning and welcome to Ayubowan, Sri Lanka. Today we have with us Dr. D. Irugalbandara, and she is a consultant eye surgeon to the Lady Ridgeway Hospital, and also she is the president of the College of Eye Surgeons. Good morning, doctor.
Good morning.
Doctor, so you are here today especially to talk about a special day, and that is the day for glaucoma.
Glaucoma.
Glaucoma. Yes. Now this disease actually is something that we are also not very familiar with. So can you first give us a description as to what this is about?
Actually, this glaucoma day is actually today is the 12th of March, and WHO has nominated this day as World Glaucoma Day. As the reason is because to create awareness among people about glaucoma and create awareness about preventing you becoming blind due to glaucoma. That's why this day was nominated as the Glaucoma Day. Glaucoma is now where there is a fluid in the eye. It's called aqueous. That is the fluid which supplies nutrition to the eye, and that fluid has to drain out. If the fluid is produced in excess, what will happen is that the fluid will create pressure, and that pressure will be exerted on the nerve in the back of your eye. So ultimately the nerve will become damaged and you can become permanently blind. The difference actually now you may have seen people becoming blind with cataract. The difference between a person becoming blind with cataract and a person becoming blind with glaucoma is, now when you have a cataract, when you remove the cataract, your vision can be restored. You can regain the vision like when you are somewhere around 16, 18, 19, like that. But in glaucoma, if you lose your vision, if you lose your sight, it's a permanent thing.
That means it can't be cured?
It can be reversed.
It can't be reversed?
It can't be reversed. That is the danger of it. That's why we wanted to create awareness in our people as well.
So that means if there is no cure, or if it is irreversible once a person is detected with glaucoma, that means a lot of emphasis has to be placed on prevention, I suppose.
Prevention, yes.
So doctor, what should people do to prevent this?
Yeah, the thing is now you should be aware that the people who are at risk, the people who are at risk are the people who are over the age of 40, and if somebody is over 60, the chances that you are developing glaucoma is much higher. It's because now what they say is that one in in the age group over 40, 1 in 200 people can have glaucoma. That means
that is quite a high percentage.
Quite a high percentage. That is 0.5%. So you can become blind, and the other reason is now glaucoma is a silent disease where you don't notice that you are becoming blind until you become blind. It's because it's a gradual process. And
so do you mean to say there are no symptoms?
There are no symptoms. Majority of because there are different types of glaucoma. Majority the glaucoma what the people are having over 40 is what is called chronic open angle glaucoma. It does not have any symptom. The only a doctor or a technician who looks at your eye and check your eye pressure can detect that you are having glaucoma. That's the danger.
So how would you know? You have to go and get regular checkups done by a doctor, and a doctor will be able to say whether
yes. The thing is now after 40s, all of us will have what is called hatharisendriya, or we will be using presbyopic glasses. So people who are going for presbyopic glasses, our message is at least show your eye to at least once to eye surgeon.
Once in the sense just
at least once. I mean you should be checked by eye surgeon at least once.
What? Okay, that is at least. But what is the frequency that
frequency is actually now once in 2 years the people will be coming for checking for glasses. So each time when they come, we check them whether they are. We look at the back of their eye, and we can detect glaucoma. I think I'll show you some pictures.
Yes, let's talk about how glaucoma can be detected actually.
I'll show you a picture. It's the top picture here. The top picture is here. It's can you focus this one please? Yeah. Now there is a structure here behind. Now this is the front part, that is the cornea, this is the lens, and here there will be the optic nerve will be on the back. Now there is a small structure here called ciliary body, where the fluid, the aqueous, is produced. That fluid is produced there, and it's drained out through the pupil forwards, and there's a small canal here. This is called trabecular meshwork, and through the trabecular meshwork, the fluid will be draining into your blood vessels. That's how the normal circulation is. So if there is any blockage in this area or this here, the fluid will be accumulated. So as a result, now you know, when a fluid is accumulated, it exerts the pressure. So the pressure will be exerted on the optic nerve in the back of your eye. So the optic nerve will gradually, now with the development of this pressure, the optic nerve will become damaged. It will go, it will, once the optic nerve is damaged, now it's like the brain. Now optic nerve acts like, it's part of the brain actually. So it will be incurable. I mean, it won't regenerate. The optic nerve won't regenerate. So that is the danger.
It is the pressure that is exerted on the optic nerve that will ultimately be the main cause.
Yeah.
So what are the causes of one sort of getting glaucoma? What are the reasons?
Yeah.
Is there health factors, the way the food you eat, or what are the factors that one has to be careful about?
Yeah, there are actually the majority of them. The age is the main factor.
That is above 40.
Above 40.
But are you ruling out like infants and people below 40?
No, I'll come back later.
Right.
I think there are certain different types of glaucoma where the children can be born with glaucoma. That is called congenital glaucoma. So they can be born with glaucoma, but that is very rare. It's about 1 in 10,000 or so, because it's a very rare disease. But no one is exempt, but everybody should know whether you are having glaucoma. That means your eyes has to be checked. So if I come back to the talk about glaucoma, now when you look at the nerve, I think this is how, when there's a gadget called ophthalmoscope, where I think most of you may have seen the doctors looking at your eye with the ophthalmoscope, and with that, if you see, what we can see is like the first picture here. Can you focus this picture please? The first picture, now where the nerve, this is the normal nerve, and there is an area called small white area, I think you may have noticed, that area is called cup. Now what will happen is, with the pressure, when the nerve is getting damaged, this white area increases. So that is how we see. Now in a person, when you look at the nerve, we can suspect whether this person is having glaucoma. It's because we know the ratio of this cup to this white area to the pink area. This cup, that's called cup this ratio. Then this is called cupping, and this gradually increases. Now you can notice that gradually this is increasing to an extent where it will become, now this is the part of the normal nerve left over. This is called end stage glaucoma, where the person is, I think, virtually becoming blind here. It's because now only the small rim of the optic nerve is left over. So what we want to do is prevent somebody going into this stage, catch them at this stage, where they are not blind actually, but they are at risk of becoming blind. So that is the idea of educating people about glaucoma.
So if you catch them at that age, where the first point, how can that be rectified?
Now with this, now we will be checking their eye pressure. The eye pressure is now is called, there are certain instruments called tonometers to check the eye pressure, and so we can check the eye pressure. The normal eye pressure is less than 21 millimeters mercury in a normal person, but it can be varying from 21 to 60s even in a patient with glaucoma.
So now when you check the eye pressure, what will you give? Do you provide medication to?
Yes, because now once if you diagnose glaucoma,